Welcome, friends. I'm Dr. Malia Jones, and I'm the editor-in-chief here at Dear Pandemic. And I am very excited today because I'm joined by three of those nerdy girls for a special all vaccine questions all the time episode of our weekly Q&A. This morning, I am joined by Drs. Lindsay Leininger, as usual, and also by Dear Pandemic contributors, Dr. Sarah Coles, who is a family physician, and Dr. Michelle Kinder, who is an immunologist. It is great to see all three of you. How's it going?
Terrific. I want to note, I'm super excited about this morning because I think it's like one little example of our broader team. We have an epidemiologist, a health policy PhD, a family medicine physician, and an immunologist. And I feel like there's a joke there that I'm not finding, but I really like the breadth of our team, and I think this is a nice example of it.
Absolutely. Can you imagine a better team to tackle vaccine questions? We've got all the fronts covered here.
And holy smokes, do we have some vaccine questions? Gretchen, our wonderful COO. Hi, Gretchen. Thank you for help producing today's show. Pulled out a lot of vaccine questions from our question box, and they were numerous. And we are so excited to get started with your vaccine questions. And please know this will be a consistent beat. Keep sending those questions to the question box. We will be writing early and often and consistently on vaccines.
Yep. So thanks for submitting them. If you have a question for the weekly live here, we don't take questions out of the question box cold, because we are big nerds and we like to do our homework before we go answering your questions. Sometimes we have to look things up. And so that means that you have to submit them to our website. It's dearpandemic.org, and the question box is right there. You can put a question right in the box. And while you're at it, you can try searching for your question. We have almost 700 posts about living in a pandemic at this point. So there are a lot of questions there. All right, so Sarah, are you ready for your first question?
Yeah, let's do it.
Okay, so we got a question from Jamie from Seattle, Washington, who would like to know, what is the status and timeline of testing COVID vaccines in children? Once vaccines are freely available for adults, do you think schools can open again, even if the kids don't have a vaccine available yet?
Thank you so much for this question. It's a super good question. As you know, currently we only have information on vaccine safety and efficacy in adults. And this isn't new or surprising, but now that we have data that shows these vaccines are likely both safe and effective in adult populations, it's time to start including kids. We want to figure out things like safety. Does it work to prevent infection or bad outcomes in children? And how much and how often do kids need the vaccine to protect them? The good news is Pfizer is starting to include kids 12 years and older in their vaccine trials, and we expect others to start following suit soon. Because one gets started and the others start to go with it, right? Mm-hmm. And once it's studied in older children, younger kids will probably get included next. The American Academy of Pediatrics is pursuing and pushing vaccine developers to start including kids so they can collect information on safety and efficacy in kiddos too. The bad news is that this is going to take some time, and kids probably won't be having a vaccine available until later in 2021. So even though we may not have vaccine for kids in time for the next school year, this is not all doom and gloom for schools. Kids just aren't as susceptible to COVID as adults, are less likely to get really sick, and aren't usually the cause of outbreaks. Adults are the cause of outbreaks. So vaccinating adults will be an important step to help keep our kids safe and our schools open.
So in there, I'll just add here that there has been a lot of discussion about putting teachers very high on the priority list for getting the vaccine. So adults who work in schools would likely be protected if schools are returning to person next fall without the kids' vaccine being available yet.
And we're not just talking teachers too, like any adult that works in schools is an essential worker, right? We need schools to function as a society. So I expect that they will be very high up in our phased priority for vaccination.
Yeah.
Sarah, may I ask a follow-up question?
Sure.
I would just love to hear a little bit about why it's so important to get safety data on kids specifically. My friends tell me that kids are not like mini adults when it comes to how they deal with vaccines. So if you wouldn't mind just giving us a little information on that, that'd be great.
Sure. And Michelle, please jump in too, because I think you probably have some expertise in this as well. But kids aren't just tiny little adults. They have different bodies, different physiologies, different responses. And so testing in kids is the most helpful way for us to know, is this actually safe in this population? We've found in the past that some things work in adults that don't work in kids, and some things work in kids and don't work in adults. So it's not just a one-to-one. If it's safe in adults, it's safe in kids. So we really need to do our due diligence to make sure that this is actually okay for children. And depending on their age of development, safe in that age as well. So we are going to do this kind of phased research approach for age.
So that's why it starts with the older kids first,
right.
And then, yeah.
They more likely to have what's considered an adult body habitus. So they're closer to adulthood. They weigh a little more. Their physiology is a little bit more advanced. So not advanced, but more like an adult.
Sarah, can you define what physiology is? That's one of those words that I feel like I should know, but I'm embarrassed that I don't.
Physiology is just how the body works.
Great, thank you.
Michelle?
Yeah, and I'll just add that in terms of your immune system, as we age, our immune system doesn't work as well. So older adults, they sometimes function differently than young, especially compared to younger kids. Younger kids have a very kind of, you could say, a fresh immune system. They haven't been exposed to a lot of different things, and the way their body works, their immune system is still developing. So therefore, like sometimes younger children maybe they need a different dose, and that's something that'll be tested compared to adults. So that's why we kind of work back to younger and younger kids, and they're going to be looking at how much protection they have, or if we need to change the dose or something like that to make it amenable to children's immune system.
And I'm just also struck by the fact that when we look at COVID outcomes among kids, the kids under 10 are very unlikely to have serious outcomes, but we do see occasionally serious outcomes in that tween through older teenager group. So you can actually see that playing out with how COVID behaves in the body too.
Yeah, and I'll add, even though it's rare, I still know somebody that was impacted very negatively by COVID that was the same age as my son. So, even when we say it's rare, it's important. He's 6 years old.
Thanks, Michelle.
Yeah.
Yeah, all of that is not to say that we shouldn't take this seriously for our children, because there can be bad outcomes for kids, and kids can get really sick, particularly kids who have maybe other medical problems too. And so it really is important that we do all of our best practices to prevent our kids getting sick. But in terms of opening schools safely, the adults are the higher risk group in that population.
Great. And Sarah, do you think there'll still be some social distancing in schools next year? Like masks will still be worn by the children, even if they're not able to be vaccinated?
Absolutely. As much as I would love for a vaccine to be the magic bullet that just, once everybody gets a vaccine, or once some of us get the vaccine, we can just stop all of this, but we're not done yet. It's going to take some time to get everybody vaccinated, or to get enough folks vaccinated for us to stop doing those things. So even when the vaccine rolls out, we're still all going to have to be doing all of those good, smart practices, right? Like masking, physically distancing, increased ventilation, decreased time together with folks outside of our household. All of those are still going to be in place.
Wonderful. So stay tuned, community. We will continue talking about children and vaccines as more evidence emerges. So I get to ask Michelle a question now, right?
Yeah.
Terrific. Okay. Haley from Tahoe. Thanks for writing in, Haley. I am a hospital employed physical therapist who had COVID symptoms and positive test back in October. The vaccines are coming to our work site. I'm curious if there's any research or guidance regarding the vaccines for those of us who've already had it.
I think this is a great question. It's a question that we've gotten pretty often as well. I think it's important to note that there's no official recommendation from the CDC regarding this question. It simply has not been studied yet. The clinical trials did not include people that have already had COVID, but we should get answers within the next few months as the vaccine is rolled out. At this time, the decision is left to the individual's discretion. That said, I'm going to take off my scientific hat a little bit and get a little bit more personal because my family is in this exact situation. So this has been, dinner conversations with me and my husband. My husband has had COVID in August, and he's currently on the high priority list to get the vaccine due to his position in the hospital. And so again, this is something we've discussed quite often. Well, first of all, immunity to natural infection, we don't think lasts very long. We know that circulating antibodies against the virus last only a few months, 2 to 3 months. So it's possible to get reinfected, and we think that having a vaccine will offer a higher level of protection against the virus. So ultimately, we're going to be encouraging everyone to get the vaccine. So him and his colleagues are kind of taking different approaches. First of all, if you are 2 months or 3 months out of having the infection, it's not likely that you have circulating antibodies and would probably benefit from having the vaccine. However, some of his colleagues are actually checking to see if they have antibodies, and if they do, are deciding to kind of hold off for a few months before they get the vaccine. Another approach is just kind of waiting to see what happens in a few months, because a lot of the frontline workers have had COVID and are getting the vaccine. So we'll find out what happens in those individuals within the next few months, and then we'll be able to have a more concrete answer. And then it's the approach that me and my husband are taking, more my husband than me. But he's going to get the shot and see what happens. If anything, maybe he'll have a stronger response to the vaccine, given that he already has some immune cells that recognize the virus. But we figured he can take over-the-counter medications if he has fever, chills, or headache that really kind of interrupt his daily life. But he does not want to bring COVID-19 home again. He's very high risk for exposure. So we know it's possible to get COVID-19 a second time, and ultimately because we need a higher level of protection than what the natural immunity to the virus offers. We're all going to kind of need the vaccine to prevent the virus from continuing to spread. But at this point in time, there's no right or wrong answers.
And it sounds like more information is going to be coming out as these
Stay
studies
tuned.
continue and the phase 4 trials continue after.
And I'd like to make
approval.
another note too. So I've been listening a lot to Dr. Paul Offit, who's a vaccine specialist, and he's on the FDA panel that's going to be voting on approving the vaccines. And he also just offers that logistically, it's going to be very hard to triage out people who've had COVID from those who haven't. The antibody tests aren't that good. A lot of people have had it, never got diagnosed. So just operationally, it, in addition to the great science that Michelle just explained, it's just is going to be too hard to sort of pick and choose. And so his thinking is it should just be offered based on the framework put forth by the National Academies of Medicine and the CDC.
Interesting.
The states and the counties are the kind of ultimate jurisdiction, the place that's going to decide who gets the vaccine in their areas. And some are suggesting that while the vaccine is very limited, they might ask people who have had COVID in the last 90 days to wait. So you also should check with your state, your county, and your local health departments about what their recommendations are. If you're a high priority person and you think you might have had COVID recently, to see if they would like you to wait or to go ahead and get the vaccine. So there should be some local guidance for you as well.
That's a great
Right.
Sarah. And I want to amplify it because I am a health policy PhD. That's my background. And one of the things I find myself saying over and over again in this pandemic is it's not really just the feds. And in fact, for many things, it's not really the feds at all. So I think Sarah's point's really good about the county guidance and the state guidance. And when it comes to things like getting a vaccine or worried about curfew orders, a lot of this stuff is happening at the local and state level. So I think just, it's in my wiring to check those jurisdictions, but I think the news coverage is mostly at the federal level. So Sarah, I'm just really glad you brought that up.
Yeah, and those 90 days are in line with when you still may have circulating antibodies, because we think that circulating antibody, well, we know based on studies that have been done that have had COVID, that their circulating antibodies last for 2 to 3 months. So within that 90-day window.
I think that's a great, can we just have a shout out to the logistics people who are trying to figure out right now? I think that the logistics folks have been trying to figure this out from the get-go, and it's been an ongoing process, but now we're poised to have a decision on emergency use for these vaccines in the next week, really. And then, there are some health systems that are going to start rolling them out immediately to their highest priority folks. And the logistical questions around how this is going to happen are totally mind-boggling. And I just want to show some love for the folks out there who are trying to figure out, like, how many trucks do we have that can ship something at negative 70 degrees Celsius or whatever the ultra cold temperature is. It's a real challenge. So
Yeah, they're heroes. Like they're legit heroes.
I want to get one of them on the show and just ask, like, how is this going?
They're too busy for us right now.
Oh, totally. So I just want to take a minute and remind our viewers right now that your questions should go in the question box at our website. We don't take questions live out of the comments on this Facebook Live because sometimes, in fact, almost always, we have to look things up. And we like to do that in advance of the show. But if you put them in the question box on our website at dearpandemic.org, we read all those questions. There were many vaccine questions this week, and I know you're going to have many more vaccine questions. And then we use them to figure out what we're going to post about in the next week and for next week's live show. So put them there and we will read them. Okay, Sarah, are you ready for another question?
Yep.
Awesome. So we've got Anna from Wyoming, who asks us, as a potential vaccine becomes available, what resources are available to make an informed decision about accepting the vaccine? As a frontline worker, I'm being told that my facility might have a vaccine as soon as early December. Although I'm all for vaccination, I am a little concerned about how new this one is. And this "it's so new" thing is something that that we're hearing a lot. And I'll have to say, I do some HPV studies, and even though HPV vaccine has been out for years and years, it's still something we hear for HPV vaccine. It's so new as a concern. So what do you think?
I mean, it is so new, and I think so many people have this question, and it really is a good question and a good concern. And all of this is still very much up in the air as we're anxiously awaiting the approval of the COVID vaccine. So it's going to be on all of us to find a trusted source, and that's going to be critical. So in general, when we're looking for information, make sure that we're practicing all of that really good information hygiene that we've learned from Lindsay over the last few months, and evaluate the sources that we're looking at. So ask yourself a few questions as you get started. Was this information written recently? Does it answer my question? Who is the author? How does this source compare to other sources? And why do they say what they say? Is there a motive behind it? You want to be a curious and skeptical consumer of information as we start looking at kind of vaccine choices. So all of that being said, we don't really have a lot of decision aids yet out there for the COVID vaccines. The CDC does have a really good page up right now with information about how the vaccines are developed, how they monitor for safety, which is going to be, I think, pretty intense for the COVID vaccine, which is good and comforting, and the benefits of COVID vaccination. The FDA is expected to hold a hearing next week on at least one of the vaccines, probably the Pfizer vaccine, and more information will be available after that meeting. The Advisory Committee on Immunization Practices, the ACIP, will meet after that, and their job is to make recommendations on the vaccine itself. To do this, they review all of the information from the vaccine trials, like how the studies were conducted, the safety of the vaccine, and how well it works. And you can actually watch this all live if you're interested. So
we
do. Yeah, we were really excited at the last ACIP meeting. But if you don't have time to spend 4 hours watching an ACIP meeting, no worries. They publish all of their presentations on their website after the fact. So you can read through all of the information that they get as well, if you really want to dig into the details. And once that's all in, the CDC has promised to release a vaccine toolkit, which should have a lot of really good information to help folks make decisions for themselves about vaccination. I also am certain that trusted medical organizations like my own, the American Academy of Family Physicians, as well as others like the American Academy of Pediatrics and so many others are going to put information out for all of us too. And you can rest assured that we at Dear Pandemic will start looking at these too once they become available, and we'll start guiding you to good resources once they're available. And I want to finish with a bit of a shameless plug. I am a family physician, so I'm a primary care physician. And so if you have questions and you don't know, please, please, please ask your primary care clinician. It is my literal job to help you find good information that is pertinent to the person that I'm talking with, my patient, and to help them make the right decision for them. So please reach out to that trusted clinician in your life if you have questions.
And I'm going to add, we got a ton of questions this week about, I have XYZ specific condition. Is the vaccine recommended for me? Those are questions that should be directed to your clinician, and not something that we'll be able to address here on the page, and so reach out to them and ask them about your, every specific condition that you have.
Yeah, if your clinician is anything like me, and they probably are, this is like their favorite thing to do. So like, don't deprive them of this opportunity. They want to talk to you about this.
Great. Okay, thanks for that. Michelle, do you have a favorite source for good, public facing? I know as an immunologist, you probably want to get into the nitty gritty way more than your average Joe, but what's your favorite source for public facing information about vaccines?
Dear Pandemic.
Yeah, seriously,
you write the Dear Pandemic vaccine stuff.
I do read a lot from the CDC's website, honestly. I think it's a great website. It has a lot of information, and all of the data is found on the CDC website. So whenever I'm doing some sort of research for something, I always go to the CDC website first.
Okay. Yeah, so just, it's we kind of laugh, but to be honest, we are planning to do a ton of vaccine posts coming up. So if you're not already a follower, hit follow, and we'll do a lot more here. All right, Lindsay, it's your turn for an ask.
Terrific. All right, Michelle. Ray, thanks for writing in, Ray, asked us, I understand the need to get the most bang for the buck efficacy from the vaccine, but wouldn't it be better to mitigate the pandemic to just get the first dose out to a larger population and wait for the second dose until we have adequate supply?
Yes. So no. So we need to commit. You need to commit to both doses of the vaccine in the time that has been studied in order to receive the vaccine. And the reason why is the immunity to the vaccine has only been studied within the clinical trials with 2 doses that are either 3 weeks apart for the Pfizer vaccine or 4 weeks apart for the Moderna vaccine. And it's likely with just one vaccination that there's suboptimal immunity. So there's immunity that's not at the level that's going to protect you against SARS-CoV-2 with just 1 dose. And 2 doses is what's required for building that effective immunity that would prevent or fight infection. And we know this in part because in clinical trials, scientists have measured the antibodies in response to 1 dose, and then they measure the antibodies in response to the second dose. And what they found is that after the first dose, there's not high enough levels of antibodies that would neutralize the virus, which is take it out, basically prevent it from infecting your cells. But with 2 doses, basically everyone tested with the data that I've seen had levels of circulating antibodies that were very high and within the range that would neutralize the virus or prevent it from infecting your cells. So having 1 dose would leave all of those high-risk individuals unprotected. So it's better to dose to what's been tested and shown to work. And I love describing prime boosts just as an immunologist, but what's happening is that the first dose is just kind of priming your immune system. So your immune cells that do recognize the spike protein, this is a little snippet of the virus, will make copies of themselves. And it's the second dose that causes these immune cells to make even more copies of themselves and produce this higher levels of antibodies that we've talked about. Importantly, a second dose is usually what's used to build what's called immunological memory. So this makes the immune cells live for longer and perhaps years. Your body has been tricked to think it's seen this invader, this little spike protein, twice. So that it definitely wants to prepare itself to higher levels and to protect against the more sinister invader, which would be SARS-CoV-2. So that's why you need 2 doses at the time that's been studied.
And Michelle, can I just add that this is not different for the COVID vaccine? Most of our vaccines are multi-dose, require multiple injections to get adequate immunization to actually protect you.
Oh, it's a great reminder. And I love hearing Michelle talk about immunology and Sarah talk about family medicine and Malia write about herd immunity. And Michelle, I hear your answer and it just reminds me of my favorite thing about being part of Dear Pandemic, and that's learning from my fellow nerdies. So
it is really fun. I wish I could invite everyone to the back channel view of the ACIP recommendation of the ACIP meeting, because it's pretty fun. It's a lot more fun than watching it on your own, I got to tell you.
And I will be watching the FDA Pfizer December 10th meeting. So
I'll see you on Slack, Lindsay.
That's right. See you on Slack, nerdies.
So this is really exciting. We are all really, really excited for this vaccine to be almost, the first 2 vaccines to be almost across the finish line and start to roll out to our highest risk people. Thinking about herd immunity, I did a lot of thinking about herd immunity this week, as in most weeks, but this idea that it's going to be out to people who are living in nursing homes in the first tier is just so exciting. That would be an incredible win for pandemic control, especially on the front of how many deaths we're seeing. That group is at really high risk, and what's happening in nursing homes is devastating right now. But I have to say, most of us have a long wait before we get the vaccine. Most of us won't be eligible likely for months. I use the New York Times Find Your Place in Line tracker, and I'm in place number 97 in line to get the vaccine. So
what's your denominator? 100?
100.
Yeah.
they have a cute little model line with 100 people in it, and I'm number 97. So
I'm there with you.
Yeah. Probably. I mean, most healthy middle-aged adults who aren't essential workers are probably, about in that same place in line. So most of us are not going to be eligible for months, and we have a long winter ahead. It's nice to see the light at the end of the tunnel, but oh my gosh, this is a really long tunnel. So, we're already at 3,000 deaths a day in the United States. Somebody asked me before Thanksgiving if I thought we would get to that. And I was like, yeah, I mean, we're already on track for that. And I got to tell you, we're already going to see 4,000 deaths a day in the next couple of weeks here. We haven't even seen the effects of Thanksgiving. So we're really in it's a devastating moment for the United States. So
Malia, on that note, can I add something?
Yeah, of course.
So we on Dear Pandemic are being very intentional about 2 things right now on the platform. And the first is vaccines, as you see today. And the second is bringing in more mental health and behavioral health content as well. So please know that our content will reflect the darkness of our days, but also the hope ahead.
Yeah. Yes. Thank you. That was very well said. So in the meantime, until you are eligible for this vaccine, we need to stay safe and stay sane. That's our motto. You can submit a question in our question box on our website at dearpandemic.org. And I have some more exciting news. Next week, Lindsay and I are going to be having another special guest, right, Lindsay?
That's right. Dr. Chloe Gibbs, an economics professor at Notre Dame, who is an education policy scholar. So we are going to do all kids in schools next week.
All kids in schools next week. And we are also lining up an indoor air expert who's going to talk to us about how to produce that, increase your ventilation situation that we all want in the face of it being the middle of winter now. So, all right, that's all we have time for today. Thanks for hanging out with us. Thank you so much, Dr. Coles, and Dr. Kinder for joining us. It was really fun to see you on the weekly live, and join us next week at 9:30. We'll be talking all about schools. We'll see you then.